Well, if you ask Canadians how they would like to die, the vast majority say at home. But research out today suggests only about a third at most have access to the palliative care they need and the death they hope for. Health Quality Ontario says dying needs to be demedicalized and demystified. It says all patients should have a choice of where they want to die, be it at home, in a hospice, or a palliative care bed in hospital. They should make plans in advance and make sure to involve their health care providers. And the panel says medical and nursing schools should increase education about end-of-life care. As one of the report authors said, many of the recommendations strike people as common sense. But as Havard Gould tells us, the good examples are few and far between.
Children play in the basement of a hospice where family members are welcome anytime.
The family seems really settled in here now.
Upstairs, a doctor reviews his cases. Patients here typically have days to live. This hospice looks like an ordinary home, and that's the point. It's not a crowded, impersonal emergency ward. There are even plates of cookies everywhere.
It's just a blessing.
This is where Catherine Rouse's mother is spending her final days.
It's those little things that you don't think about. It's the fact that she has real sheets on her bed that she would have at home. The fact that she's wearing her pajamas.
So for the next bed that becomes available.
This facility has just 3 beds and usually takes in patients with less than 1 month to live.
They can have their stuff around them, their people, their loved ones around them, and it's like their home. If somebody wants a rye and Coke at 2 in the morning, then they can have a rye and Coke at 2 in the morning. If they want ice cream at 5, they can have ice cream at 5. We help people live until they die.
The vast majority of Canadians with terminal illnesses have no choice. They die in hospitals. There's growing evidence that palliative care, at home or in hospices, is usually what patients want. It's also cheaper. But the healthcare system has been slow to respond.
We tend to be a very death-denying society, so focusing on hospice, palliative care, etc., has been difficult for the general population.
The report in Ontario is pushing for change, just as Canada's aging population is putting more pressure on hospitals, budgets, and families.
It was a big step because it was very last minute.
Adam David's mother was grateful the hospice had room for her. She died less than 3 weeks ago.
I remember her saying she was really glad she came here, that she didn't wind up, the 20th bed in an emergency ward or something.
Which, for many Canadians, is still the only option. Havard Gould, CBC News, Toronto.